In Part 1, we discussed the basics of fibromyalgia. Today, we will discuss how to cope with it effectively.
It is vitally important to establish healthy lifestyle behaviors which will help you reduce your pain, increase your sleep quality, and lessen the fatigue that accompanies fibromyalgia. All of which are important aspects of managing your pain and having a more fulfilling life in spite of it.
Let's explore fibromyalgia and fatigue.
Fatigue is actually the #1 complaint about living with fibromyalgia. According to the latest statistics, fatigue exists in about 95% of all cases. Excessive fatigue has a negative impact on the symptoms of fibromyalgia, particularly pain. Because of the pain, many patients experience unrefreshing sleep, increasing fatigue, and exercise becomes difficult and sometimes feels impossible. To decrease fatigue and enhance your effectiveness and the way you feel, you will need to make some basic lifestyle changes. Prioritize your tasks. By accepting the fact that you cannot do the things you have done in the past, you will decrease stress and anxiety, allowing you to do more of what you would like to do. If you push yourself to do more than you are able, you will only succeed in making the symptoms worse, missing out on the most important things. Meditate. If you create an environment in which you are able to relax, you will find that your physical and emotional health will be better. And focus on holistic therapy. Finding balance is key to remaining a vital participant in your life and in the lives of others you may touch. Our body has the power to heal itself with multiple techniques, including those that involve the mind, body, and spirit. Complementary and conventional medicine can be used together to give you better control of your symptoms. Talk with your doctor about alternative treatments that may be beneficial to you. Both biofeedback and electroacupuncture have been used for relief of fibromyalgia symptoms. Working with your doctor, you may find an acceptable way to blend conventional medicine with alternative treatments or natural remedies. If you do, you may be able to enhance your ability to get refreshing sleep and reduce your pain.
Oh, here comes that vicious circle.
Fibromyalgia pain makes exercise, sleep, and relaxation difficult and can make one's life seem impossible to bear. The pain also limits the amount of sleep and lessens its restorative quality, contributing to increased fatigue. Many sufferers find they are just too tired to exercise, or believe they will cause more pain, and omit or hesitate to include exercise in their daily routine. Lack of exercise causes the fatigue to become overwhelming, making it even more difficult to get rest or participate in a regular exercise routine in the future. As the patient's fatigue increases, so too do their pain levels, causing even less desire for activity and healthy exercise, which again leads to increased pain levels. This cycle will continue to aggravate fibromyalgia if the patient does not strike a healthy balance between rest and exercise.
Let's talk about fibromyalgia and exercise.
The benefits of exercise for fibromyalgia patients include improvement in pain levels, increased ability to manage pain, and an overall sense of well-being. Because many patients with chronic pain fear that activity will worsen their pain and fatigue, they don't exercise, resulting in their muscles becoming deconditioned.
So, exercise and fibromyalgia should go hand in hand. Where do I start?
Graded aerobic exercise should start gently and progress gradually to endurance and strength training. Obesity, poor posture, and overloading activities at work or at home should also be managed. Too much weight or stress contributes to increased pain. A good fibromyalgia exercise program, consistently followed, will relieve pain, strengthen connective tissue, increase flexibility, and improve circulation. In addition to diet changes and nutritional supplements, a daily exercise regimen is vital to managing fibromyalgia.
What are the best types of exercise for fibromyalgia?
Stretching exercises condition your muscles. Take it slowly when you begin your exercise routine. Only do a few stretches a day and don't hold them for longer than 3 seconds. Aerobic conditioning exercises stimulate our body to produce endorphins, which are our body's natural painkiller. After activity, the endorphins actually help to reduce the stress and strain in your muscles and improve your mood. Good. Low-impact aerobics include walking, cycling, water exercises, and dancing. Remember, start slowly. Strength training helps your muscles get used to activity again, and build up their tolerance to pain. It will also help you get back the mobility that fibromyalgia may have taken away from you. When you begin strength training, use the lightest weights possible, even if it's just a 2-pound weight, or use the elastic bands designed to create resistance.
Managing fibromyalgia.
There is no question that your life changes once you have fibromyalgia. However, it does not have to stop you from living, or doing the things you really want to do. Keeping these tips in mind will help you make the most of your available energy. Ask for help. Make time for yourself every day. Eliminate stress. Learn to say no without feeling guilty. Don't blame yourself. Keep a date timer. Don't judge yourself. And stop and smell the roses.
Successful fibro living.
Part of living with fibromyalgia requires making changes that complement your treatment, reduce your stress, and allow you to live a normal life. When planning your time, aim for these daily goals. Schedule time to relax every day. We are most effective when we allow our body and mind to recuperate, and we will often sleep better at night too. Deep breathing exercises and meditation helps reduce stress and aggravates symptoms. Massage is an effective way to relax and can be quite therapeutic for managing stiffness and pain. Taking some time for yourself every day allows you to refresh and rejuvenate. Fibromyalgia is a chronic condition for which there is no cure, but it can be successfully managed by following your treatment plan. Symptom management should focus on the whole self, medical, emotional, and physical needs. Many fibromyalgia patients find that when they incorporate their spiritual needs in their daily activities, they feel less isolated. Developing a healthy diet will ensure that you get adequate nutrition every day. Eat plenty of fruits, dark vegetables, and drink at least 8 glasses of water daily. Soft drinks contain sodium and acid that erode your teeth, and energy drinks are full of sugar and actually deprive you of needed water. Avoid milk chocolate and chocolate sold as candy, since these contain high percentages of milk and refined sugar. If you just cannot live without chocolate, opt for dark chocolates with a high cocoa content. Should you find that you are falling short nutritionally, supplement your diet with vitamins recommended by your physician. Rich foods can also aggravate symptoms, especially if you suffer with IBS. A regular exercise routine is of particular importance to the fibromyalgia patient. While difficult at first, regular exercise often reduces pain symptoms and fatigue. patients should follow the adage, start low, go slow. Remember, it takes time to establish a comfortable routine, so just get moving, stay active, and don't give up. Going to bed and waking up at the same time every day can reduce associated sleep problems. Avoid daytime napping, and limit caffeine consumption, which can disrupt sleep. Finally, since nicotine is a stimulant, those with sleep problems should stop smoking. Getting enough sleep allows the body to repair itself, physically and psychologically. Knowledge really is power. If you are well informed and understand your condition, then you are better prepared to deal with issues that may arise. Community-based and certified online support groups, as well as nationally recognized organizations like the Arthritis Foundation and the National Fibromyalgia Association, are excellent sources of information. It is important to your overall health management to know what to expect and what you can do to prevent avoidable difficulties. Here is a chart on which is outlined the steps to success. It is available in the related companion guide available on our site.
Fibromyalgia symptoms can be managed if you keep these 3 very important points in mind when planning your time.
Follow your prescribed treatment plan, and don't blame yourself if you are unable to participate in some activities. Learn to say no, without guilt, and remember to invite others to ask again. And develop a lifestyle that accommodates your fibromyalgia, and take every advantage to cherish the truly important things in your life.
If you are experiencing difficulties with self-management, discuss the problems with your physician, so they can recommend a qualified cognitive behavior therapy counselor.
Cognitive behavior therapy can help you learn to restructure your life, and help change your feelings about living with a chronic pain condition.
You can also contact your local mental health clinic to find a qualified CBT counselor. We hope you enjoyed this presentation. Please look for our other information videos.
For more information, visit us on the World Wide Web. Chronic pain and depression. www.pain-and-depression.com